Hi, Dr. Bo again. Well, mentioning the nerves, how the upper sensory nerve and a lower sensory nerve, and those two help each other. The upper sensory nerve calms down the lower sensory nerve in the same way the upper motor nerve calms down the lower motor nerve. And we discussed that you take away that upper motor nerve and you end up with a hyper reflex in the lower motor nerve. So the nerve at the top nerve from the brain down to the IVF is usually a nerve that calms things down, tells the muscles to relax, not to spasm. So when you see it, a lot of times when you have a tight muscle and so forth, it could be a small version of that. You have an losing the upper nerve message to calm down, and you end up with a tight shoulder. Another problem we have in diagnosing is that the discs have a pain system set up. I believe it's called scleratogenous. So it's scleratogenous pain, which is sort of like soft tissue pain, and it comes from where the nerve came from in the embryo. So we have the embryo dividing, and the cells go to the C5 disc, and those same cells in the embryo go down to the rhomboid muscle right here. And that's a real common one we have trouble with. A patient will come in with pain right there. And if you have pain right on the rhomboid medial to the scapula edge, that's not always a rib out or a vertebrae out. It can be radiating pain from the C5. They're like brothers in the womb. And now when you have a ruptured disc or a disc in a whiplash, that again, the discs don't have a lot of pain fibers. So when you have a disc that's in trouble from a whiplash, a lot of times the patient will come in and say, "Doc, it hurts right there, work right there." And the doctor spends a lot of time on that rhomboid region, or that, right there, thinking, "Oh, it's gotta be a problem there. That rib is out." See, there's the rib joints right there. You can see the rib. See the rib articulation? That's where the ribs sort of fold around and go around to the front of the body, and they don't all the time. All the ribs don't even make it all. The bottom ribs don't go all the way around to the sternum, just the middle ones. So you'll get a pain, back to that, you'll get a pain right here, and you think, "Oh, it's gotta be it." And they'll work and adjust an elbow and spring, pop and click, and it's coming from a radiating brother type pain with C5. The disc at C5, again, you can cut that disc. I'm sure they can do surgery on that disc without anesthesia. You're not gonna feel it. The disc doesn't have a lot of pain fibers. Most of the pain fibers, again, come from what? The facet in the back of the spine. So that's where most of the pain comes from, in the back. But in this instance, the C5 disc is in trouble. One of the lamella is breaking, or pressure inside the disc is building up, and the radiating pain is a rhomboid issue right there, and it's always in that same spot. I can reach around and put my finger, it's right there. That's the C5 disc in trouble. It's either swollen, torn, some kind of issue with a C5 disc, and the pain is right there, as feels like a rib is out or some kind of vertebrae is misplaced, and it's not. It's the disc is in trouble. And a little trick I do is you ice down the disc. Now, when you use ice and you're trying to numb up the facet or this nerve here, you got to remember that the skin, it fools you. The skin is like way out here. You got the rhomboid muscle, you got trapezius muscle, you got and it's almost 2 inches down, especially in the low back, a long way down. So when you do ice on your back, if you're trying to numb up that nerve or that facet to get rid of pain, and that's a good way to check for that rhomboid issue from the disc. If you ice down the disc and numb up the disc, and that rhomboid pain goes away, in my mind, that solves the problem, the radiating problem, and that tells you it's coming from the disc. It's not a rib out or a vertebrae out at that T4, 5 level there. So check that with an ice cube. Take an ice cube and lay on the couch on your side and reach over with some ice and try to get in this gutter right here. And you got to remember, your ice cube is way out here. So you start doing the first ice cube and it melts really quickly because the skin is warm and everything. You get to the second ice cube, you've got to do 12 minutes. So time it on your watch, 12 minutes exactly. At 13 minutes, the skin starts to get frostbit. So you want to stop the ice application at around 12 minutes. So have that, because I've seen patients come in here and they do 15, 20 minutes and they've got frostbite and now they can't do any more ice because the skin's all damaged. So understand it's going to take a long time because there's blood vessels here, right? And the blood vessels are wicking away the cold. The cold is trying to get down to that facet to numb it up. And the blood is in here, the warm blood is in here wicking it away. So finally, the blood vessels, what do you get in the winter when you're in, not in Florida, we wouldn't know that, but when you go out in the cold, the first thing you get is white cheeks because the blood vessels go, oh, give me my blood, I'll keep it warm in here. And then finally, the blood vessels they lose oxygen and they can't hold tight anymore and they go, ugh. And the red blood flows into your cheeks and you get red cheeks at around 11, 12 minutes of freezing because the blood vessel, this is a good one, the blood vessel has a muscle layer in the middle. They're called tunicas. So you have a tunica interna, a tunica externa, which is skin cells, and in the middle of the arteries, there's a muscle layer, and that opens and shuts the diameter of the blood vessel. So you apply the ice to this blood vessel, it's pumping blood through there, and it goes, hey, keep warm, keep that blood warm, keep that blood warm. So it starts to make the capillary smaller, and then finally, the muscle layer, which is doing this, can't get any oxygen. So what does it do? It fully dilates, bigger than it could if it was dilating. It just totally relaxes and you get a big dilation and your cheeks turn red from all the blood going in there. That's what we're trying to do with the ice. The ice is going down through here. It tightens up the blood vessels. They're trying to wick away the cold. And then finally the blood vessels shut down so far, they can't shut down anymore. And they go, and the cold is allowed to pass. The cold passes. And in about 7, 8, 9 minutes, it makes it down to the facet, and the pain in the neck goes away at around 7, 8, 9 minutes. And of course, we're waiting to see if we can get down to the nerve a little further, and around 12 minutes, right about the time when the cold is arriving at the nerve to numb it up with the ice, is about the time it's going to be 12 minutes and it's time to stop. So that's why we don't want you doing this with the ice. Just go to a nice, narrow on the skin, you're way out. Remember, you're way out here. You're not down here on the ice. You're just out here and you're doing the ice. And right around 12 minutes, it'll take that long to get some pain relief, anesthesia to the tissues in here, the disc or the radiating pattern. So the radiating pattern was going down to the rhomboid area, and right around 11 or 12 minutes, the ice got there, and you can see if the rhomboid pain went away. So did this pain go away at around 12 minutes? It's not going to go away at 8 minutes. In fact, most people stop applying the ice at around 8 minutes because it gets a little stingy and gets a little sharpy and they can't take it. So what do? They stop. And of course, the whole process stops. So you've got to get past that 8-minute mark, which it finally goes into numbness and you don't feel it. And you can go ahead further with the ice. And again, 12 minutes, 13 minutes, that skin's gonna freeze. So make sure you've got that ice going down there, finally getting to that facet, numbing up the radiating pattern, and that will tell you if the C5 is causing the radiating pattern, right? If you get no relief from applying the ice on C5, then it could be a real rib issue or a vertebrae out of place. But 9 times out of 10, that pain you get right there is caused by a whiplash or a tear or a bruising of the C5 disc. That's a nice little bit of information there, tuck in your hat. Take care, like and subscribe.